I've heard you talk about like that one of the main problems with society today is that a lot of people who have mental health struggles and they're dealing with trauma, and then they might go see somebody who's not trained in trauma. They don't have the experience. Like, how can somebody begin to take that path and make sure that they're finding somebody that is trained in that, and then also that they're able to self regulate themselves when needed?
Well, that's a huge question because unfortunately, look, I've been through medical training. I'm a physician, and the average physician never hears any of the stuff I just talked about. The average psychiatrist doesn't get any training in trauma. Not in, they learn something about PTSD, which is a specific form of trauma, but they don't learn about the traumatic basis of depression and anxiety and ADHD, and they learn nothing about it. So that it's very difficult to find good help within the medical system. Now, many therapists also don't get any such training. There's a lot of therapists that are designed only to change your beliefs and your behaviors, but not to address the fundamental reasons for those behaviors. So, a lot of psychologists trained in CBT, cognitive behavioral therapy, or dialectical behavioral therapy, a lot of them are not really, and I know this, believe me, I know this, they just don't know much about or anything about trauma. Then they can't help you with the fundamental wound that you're carrying. They can help you with the manifestations, and that's not useless, but they can't help you heal at your core. So then there are therapies that are deeper than that. There is body-based therapies such as somatic experiencing, developed by my friend and teacher Dr. Peter Levine. There's sensory motor psychotherapy developed by Pact Ogden. There's EMDR that works for some people. There's internal family systems, or IFS, developed by my friend and colleague Dr. Richard Schwartz. There's compassionate inquiry, which is based on my work, and I train therapists in that method. There are other names I could mention. There's Larry Heller, Lawrence Heller, and his work and his students. So what you have to look for is somebody who's trauma informed and is willing to work with you, not just on your behaviors, but on your core wounds, of which the behaviors are symptoms.
Yeah, thanks for bringing that up because, like, in my own experience, I mean, I've struggled off and on with my mental health over the years. I mean, I've told you a bit about my story in our last conversation. And, when I would go, there wasn't like a lot of talk about my childhood. It was just like, all right, you're having some anxiety. Cool. Like, here's a pill. And then I would just take it and I would just think, okay, this is going to cure my anxiety. And then I would realize, like, it's not really, I'm still getting anxiety. I'm still struggling. Like, what's going on with this? And it wasn't until I understood, like, my past and my trauma and how that was all related to what I was experiencing in the present that things were able to change. And so let's just say that somebody has now, they found somebody they're comfortable with that's helping them heal their trauma and change their present and their current behaviors and patterns and that sort of thing. And then they go down weeks down the road, months down the road, and they're on the up and up, but get triggered or they experience a situation where they're like, oh my gosh, like I thought I was getting better. Why is this coming up? What's your advice to people who are dealing with triggers when they're on the road to recovery from trauma?
Well, there's two ways to ask that question that you just raised. Why is this coming up? Is that a question? What is it actually?
What is this teaching me?
No. When you say, why is this coming up like that? That's not a question. It's a statement. It's a statement that says, this shouldn't be happening to me. Okay? Now, you ain't going to learn anything that way. But if you actually ask it, I wonder why this is coming up. Now you can learn something. If I came to you and said, why are you doing this? How would that feel to you?
I would probably get defensive and I would just feel like a little ashamed.
Exactly. But what if I said, I wonder why you're doing this?
It would force me to think a little bit and practice the pause and say,
Well, I don't know if it would force you, but at least it would invite you, right?
right, right, right.
Yeah. Now, so that's the first point, is how should we ask this question? It's a good question, but we have to ask it as a question, not as a statement of resentment or resistance. That's the first point. The second point is use the word trigger. Really great word. Now, if I showed you a rifle with a trigger, how big a part of the rifle is the trigger?
It's very small.
Very small. For that trigger to set off anything, what there has to be? There has to be a mechanism to deliver ammunition. There has to be ammunition. There has to be an explosive charge. When I get triggered, let's say you say something to me and I get triggered. What you said was a very small little thing. I'm the one who's got the explosive charge and the ammunition. You didn't cause me to do that. If I didn't have that ammunition explosive charge, You could say whatever you want, and I just sit here saying, I wonder why he's saying that. So triggering is a great opportunity to learn. When you get triggered, you could either focus on resent and resist the trigger, or you could say, what was I still carrying inside that I haven't looked at yet, that I haven't resolved yet? So if, I used to tell this story, we've been married 53 years now, my wife and I. So let's say 20 years ago, I might ask to sleep with her and she would say no, which is, nobody can ever believe that ever happened, but it did used to happen. And how would I respond? I would respond by going to a rage and curling into a fetal position and not even wanting to live. Okay? Now, the trigger is the no that she said. The explosive is my belief that I'm being rejected and abandoned and not wanted, and that I'm an infant and helpless, which is what happened to me. Otherwise, if she says no, I can get curious. Are you tired, or have I done something to turn you off, or is there something going on we can talk about? Or I can just be disappointed and let go of it and say, okay, well, thanks, there'll be another day. So how I respond is not dependent on the external event. It's dependent on what charge I'm carrying. So triggers are wonderful times to learn about yourself. So if you ask the question, not why did I react that way, but I wonder why I reacted that way. Now there's a whole lot of learning to be done. So that's what I call compassionate curiosity, where we're actually curious about ourselves, but not in a self-judgmental way, but in a compassionate way. Oh, this brought up the pain of rejection. Obviously, I'm still carrying that wound. Well, let's look at that because it's not happening in the present.
I'm glad you brought that up and that we have to change the language and how we talk to ourselves during those moments. Because for me personally, I'm extremely hard on myself. So that like voice that you were saying, like, like, why is this happening or why is it doing this to me? Like, that's something that I've said in my life very, very frequently because of the fact that I'm really hard on myself. I sometimes, when something doesn't go my way or when I get triggered or bothered by something, even though I've done a lot of work on myself. I'm so hard on myself because I'm like, gosh, like I'm better than this. I know I should be doing better than this. So that was really eye opening for me. So thanks for sharing that.
Well, and that voice in your head that tells you all that stuff. In this book, I actually talk about getting into a relationship with that voice because this is what I call a stupid friend, because at some point, that voice came along when you were quite small. See, if you were suffering as a kid or things weren't going well, there's two assumptions a child could make unconsciously. One is, the world is dangerous, my parents don't know how to love me, value me, I can't trust anybody, I'm all alone, I'm going to suffer in this world. The other belief unconsciously is, there's something wrong with me, and maybe if I work hard enough, I can fix it. Now, which belief is more protective for the child, do you think?
The second one is more protective.
Exactly. So it came along as kind of a friend to keep you going. It's a friend. I say it's a stupid friend. The reason I'm joking when I call it stupid, but the stupidity comes in because it doesn't learn that you're no longer that child. It keeps giving you the same message. So my suggestion, Doug, is next time you hear that voice, say hello to it and say, thank you. You know what? Because ask yourself, how old is that voice? I mean, how old were you when it first came along?
I mean, I was young because I remember there was this idea that I developed about myself from when I was a child that I wasn't good enough because I wasn't picked for sports teams. I got yelled at a lot.
So give me an age, 5, 6, 7.
Yeah, I mean, I would say I was in elementary school, I think.
Well, let's call him a 7-year-old. This voice is a 7-year-old kid telling you a story. So say hi to it. Hello, I got it. You're still working to make me better in this world, but you know what? Relax, kid. I can take care of it now. It's just a little immature little friend. That's all it is. It didn't come along to torment you. It came along to actually protect you.